Welcome back. Isn't that a beautiful? Isn't that helpful? On Random Bits this morning, we actually brought you things to consider while going for an interview. In my own little way, you've heard what we have to say about that, but I want to say that before you embark on an interview, you just have to do your research on the company. It's not good enough when you are going for an interview without even knowing, something even much, I would say, about the company you are applying with, it doesn't speak well. Then I will say that your job description. At times when we are looking for job, anything I will do. Like, don't worry, I can do. Look at your job description. Is it what you can actually do? So that when you eventually gotten that job, it won't be as if it's difficult. And again, dress appropriately. You are not going for fashion show, you are not going for a show off, just for them to know your fashion sense. It's not the time for you to let them know that I'm a fashionista, I will do this, I will simple and corporate, because it's an interview. Just behave well, comport yourself, arrive early. With this, we believe that this year you will make a difference, in searching for job. So away from that, we move to the next item, which is the interview segment. Just like I told you at the beginning of the program, that on our interview segment this morning, we will be creating awareness. It's to create awareness about a particular infection, disease that is around. We want you to be careful, to when you see the symptoms, you should just move away from what can cause this. That is all what we want to tell you about this particular disease we're talking about, and it is diphtheria. Creating awareness about diphtheria. And I'm not going to be doing that by myself. I have a guest in the studio. It is a doctor. This is a doctor that will be telling us all what we we need to know about diphtheria. And I have Dr. Abayomi Ibrahim from the Department of Public Health from the Ministry of Health and Human Services. You're welcome, doctor.
Thank you very much.
Yes, I'm alright with that introduction, but let people meet you. Let them meet you. Do the introduction yourself.
Thank you very much. Just like the moderator have said, my name is Dr. Ibrahim Abayomi. I'm from the Public Health Department in the Ministry of Health and Human Services. Thank you.
All right, thank you, doctor. We're talking about diphtheria. Yes. So what is, I want to say that, some people, they're hearing this for the very first time. I believe that there's some people that don't even know at all about this disease, diphtheria. Please, what is diphtheria?
Well, again, good morning, viewers. Diphtheria is a bacterial disease that is very contagious. It's caused by a gram-positive bacterial disease that we call Corynebacterium. It has different kinds of strains, and it's very infective and contagious. So however, it's a vaccine-preventable disease. In other words, when one is immunized against it, it's preventable. It will not be able to really affect one that is immunized against the disease. So that's why we talk about the need for all our children to be immunized right from childhood.
Thank God that the disease infection is preventable. Yes, but what are the causes of diphtheria?
Thank you very much. Again, like I said earlier, The principal cause is an organism that is gram-positive organism. There are about 2 strains of them. We have the C. diphtheria, which commonly affects the respiratory tract, and then the other one is the ones that is caused by the C. ulcerans, which usually affects more of the skin. The one that affects the respiratory tracts affects more of the throat, the back of the mouth region, and the throat, and this can cause what we call a mucocutaneous patch on the respiratory tract, and this is the mucocutaneous type. While the other one is the cutaneous type. In other words, it can be found on the skin. The one that affects the throat is called the membranous type, and the reason why it is called the membranous type is that when you open the mouth of a patient with diphtheria, you can easily see a kind of a grayish or whitish patch on the inside of the throat, and so that is very more catastrophic, and so that's why we talk about prevention. Thank you.
Thank you, doctor. The disease is transmitted one. So what is the mode of transmission?
Yes, thank you very much. Diphtheria is a transmissible disease. It can be transmitted via direct contact with individuals that have the disease, or by it is also airborne. In other words, through respiratory droplets, through sneezing or coughing. So if an individual who has the disease is actively producing the toxin, it could actually transmit this to somebody else who is in close proximity with the carrier. So we usually say that whoever has it needs to immediately report to the nearest health facility to commence treatment in order to reduce the transmissibility and severity of the disease.
All right, thank you. Doctor, you have been saying this, but some people will not still understand. Like, can you break it down? Like, if you do this, you will have, what and what we should not do, like that.
All right, thank you very much. Viewers at home, I want to advise us to please ensure that you look around. If there are symptoms of individuals or persons, could be children or even adults, who are coughing, and if it's a recurrent cough, and the individual is also sneezing, you will have to also be very careful, because it could just be one of the initial symptoms. The temperature of the individual will be rising, so there will be fever, and the fever could be high grade, usually at about 38 degrees centigrade. So we have fever, we have coughing.
For the symptoms?
Yes. Okay. We have sneezing. Okay. So if you notice these symptoms, and of course sore throat around the throat area, or other kinds of swelling of the neck. In fact, in children, the entrance or the entrance to the throat might actually be swollen, and if it is swollen, it will narrow the passage of air, right? So the individual may have difficulty to breathe. Okay. So there will be difficulty in breathing. To even swallow might be a problem, because both the back of the mouth and the back of the nose is actually inflamed. Yeah, okay. So we have what we call nasopharynx, we have what we call pharyngitis, and even the inside of the throat itself, where voice is coming out from, which we call larynx, can also be swollen. So all of those will make that neck area be swollen like a bull's neck. Mm-hmm. So when you see the neck of a child swollen like a bull's neck, we quickly suspect diphtheria, and we do the needful by taking them to the nearest health facility.
Thank you. So how can it be treated? Let's look at the treatment of the.
All right, thank you very much. Once we detect anyone presenting or having the kind of symptoms we have described earlier, what we need to do is to report to the nearest health facility, so that our health workers will quickly take note of it and let the person receive treatment. We have antibiotics for treatment of diphtheria, and we have also received what we call diphtheria antitoxins, because the toxins are what these organisms is releasing. When these organisms release toxins, those toxins are what is responsible for all of the symptoms I described earlier, like the
swelling of
the swelling of the neck, and even the patch that covers it. Now that patch that covers it is actually looking like a membrane. That membrane is a very delicate one. If for any reason it bleeds, anything touches it, it can bleed, and the individual could be lost. So that is what makes it a very catastrophic disease. So we advocate that the person please report to receive the diphtheria antitoxins, and also the antibiotics which we already have with us. And it's also important for us to say that we have centers where infectious diseases like diphtheria like this are being attended to. We have our Ekiti State Teaching Hospital in Ado Ekiti. We have the Obadeju Igbe General Hospital, and then we also have the Federal Teaching Hospital. They are fully equipped and ready to handle any case of diphtheria outbreak. Thank you.
All right, thank you, doctor. They say prevention is better than cure. So how can we prevent this?
Thank you very much. Like I mentioned earlier, diphtheria is a vaccine preventable disease. In other words, it is preventable and it is curable. So if we as much as possible take our children right from birth to the hospital for vaccination, it will certainly curtail the incidence of the diphtheria disease, because we have the vaccines that are to be taken at a certain stage in the life of the child. Okay. We have what we call the Penta-1 vaccine that is taken from the 10th weeks, another one, the Penta-2 at 14 weeks, and then we have another one, the third one, which is Penta-3 as well. So we advocate that as much as possible our mothers should enroll for immunization of the children. Once we are able to do that, you can be sure that our children will be protected from diphtheria.
All right, thank you. All being said, at times, all those symptoms can even appear, and some parents, they don't want to go out. They're still thinking it is not it, is that. You as people that you are around, probably the streets, the neighborhood, what should people do when they see someone with the symptoms, around?
Thank you very much. We expect that anyone who sees anyone with some of these features or symptoms, like fever, and the individual is coughing, person cannot eat because of difficulty in swallowing, the person cannot breathe well because of difficulty in breathing, and the individual is weak and tired, and because of excessive sneezing and coughing, we need to take a precaution to first ensure that there are no other children or persons that are in contact with the patient, and as much as possible also quickly take the patient to the hospital or to the nearest health facility where this is notified and reported, and the patient will take treatment. And not only that, the reason for notification and reporting is so that we can also look with our public health officials can also go back to the neighborhood of the child or the patient and also see if there are anyone around who may have also contacted the disease, or who are probably manifesting some of these symptoms and will probably need to be treated as well. Because what we do is we make sure that they are in the we'll try as much as possible to take our medical laboratory scientists will usually take samples from the mouth or the back of the nose where the symptoms and where those organisms are, and then take them for investigations. So when they are confirmed, that is when we can really say this is diphtheria. Otherwise, with those symptoms alone, we'll classify them as suspected cases, especially when they have the symptoms I've described earlier, in addition to the membranous patch, which could be visible on examination of the back of the mouth. So these are the simple tools that we use for getting them. So as much as possible, please, our viewers who want to counsel us to please, if you notice anyone that has any of these symptoms, the person is coughing or sneezing or has high temperature or fever or has difficulty in swallowing, or even the person has difficulty in breathing, please, it's enough for us to quickly take the individual to the hospital or health facility for treatment as well as notification, so that a public health official can also go into the environment and check if there are other people, so that we can curtail it, so that we also prevent the spread of the disease. And also, in addition to that, our mothers, especially, because most of the time they are the ones who are responsible for the care of these children, we want you to please ensure that you take your children to the health facility, obtain an immunization card for them, and get them registered as much as possible right from birth, because the vaccines they are supposed to take begins from the first day of birth. They will take them at 6 weeks. They will begin to take the vaccine for diphtheria at 10th week and also at 14 weeks. So this is how they will continue to take all these vaccines to prevent them from having all kinds of infection at all, not only diphtheria. We are interested in preventing all kinds of diphtheria infections, like measles, like diphtheria, and other kinds of infections that the vaccine is meant to prevent. Thank you.
All right, thank you. So I want to ask that your own from the Ministry of Department of Department of Public Health. So what are you doing, as in how are you creating this awareness for people to really know about this? What other things are you doing to make people
Thank you very much. Already we have our risk communication platform. They are already doing community engagement. They are reaching out to the communities in the entire 16 local government areas of the state, and then also we have plans in the pipeline to also begin to roll out jingles about all the vaccine preventable diseases, in which diphtheria is also one of them. Very soon we'll begin to hear all of this, and then we want to continue to have engagement like this, focus discussions like this on air through electronic media, the radio and television, as well as also have our health educators and mobilizers in the state local government go around to create awareness and mobilize the people and inform them about this outbreak, so that the people will know what to do when they find any of such in their locality. Thank you.
All right, thank you. You said that the parents, the mothers should register their children for immunization. I want to ask, this diphtheria and vaccine hasn't been part of the baby's
exactly
right away.
Yes, right from birth. It's
okay.
a package in the childhood.
Even from the babies that
yes,
are not
the childhood immunization schedule.
Okay.
Right. We have the first vaccine is the BCG,
yes,
which is mainly to prevent tuberculosis. Then we have the DPT, which is the diphtheria, the one that takes care of diphtheria, pertussis, and tetanus. Where the newly branded one has also packaged other things like what we call Haemophilus influenza into it. It has also added what we call pneumococcus vaccine into it. So it's a package. That's what we call the Penta vaccine. So there are 3 shots that the child needs to get: the Penta 1, Penta 2, and Penta 3. And then, of course, there is the measles vaccines, which is usually taken at the 9th month. Yes. So, and then, of course, even beyond that, we have booster vaccines that we usually give. In other words, just to continually boost the immunity of the child. And all of this is what is packaged as our routine immunization. So we have our team of vaccinators who go around from some of them are on fixed posts, some are there in the facilities, some of them even go from house to house to do vaccination. So these are all the avenues for us to get vaccinated. So all our mothers need to do is to go back to the health facilities and get their children vaccinated. The reason for this is because we have had mothers who had begun the process. Maybe they have taken a shot of the vaccine and they have discontinued. So we don't want this, because if they don't complete the entire vaccination process, they will not be immune against those diseases. So that's why we want them to take it. If we have more than 80% of our people in the community who have actually taken these vaccines, there is what is called herd immunity. Virtually everyone will be immunized against all of these vaccine preventive diseases, and the community will be safer for all. Thank you.
Thank you. Yes, just before we go on this segment, once again, your advice to the people generally, everybody, including the mothers.
Thank you very much, viewers. Again, I want to counsel and advise us to please be watchful at this time. We have vaccines. We have all kinds of infections that may be everywhere right now. We need to be on the lookout. Once you see anything on probably your children, maybe on their skin, the skin is itchy, or any kind of abnormalities at all, please, let's do the needful by reporting to the nearest health facility. Let's not assume that it's a minor thing. Let's take our health very serious. It's important, because health is wealth. So immunization is our preventive tool in public health. So we advise our parents to please ensure that all our children are immunized against all kinds of vaccine preventable diseases, and indeed all other kinds of infectious diseases. Thank you very much.
Thank you, doctor. Thank you for coming on this program this morning. And yes, the people at home, the viewer at home watching, especially the mothers, everybody, you've heard it from the doctor. The diphtheria, we just have to take the appropriate measure. We have to just take care of ourselves. And if you notice any symptoms, just don't say that this is a cold season, this is Ramadan season. At times you have course, don't just think about it. Just report yourself. Like, just go to the hospital, get tested. If it is not diphtheria, they will not treat you for that. They will say that it is not diphtheria. And if you notice people around that they are saying, no, I don't want to go, please let them go. Encourage them, urge them to go. They will get tested. If it is not diphtheria, they will release them and treat them for normal thing that is happening to them. And for mothers, please, let's enroll our children for the immunization. It's not everyday things, it's probably the first day in life, 4 months, like that, till 9 or thereabout, you are free again. So let's take these children for all their immunization. It will help you, and it will actually help the children and help the people around and make the community safe for us all to live in. So I want to thank our Dr. Abayomi Ibrahim from the Department of Public Health, from the Ministry of Health and Human Services, for coming on the program. Thank you for coming, Doctor.
Thank you very much.
I really believe that, the people at home will stick to the advice given on this program this morning. Thanks for watching this segment. The program Weekend Special. Stay continuous. Don't go away.